Over the years, technology has changed our world. It has improved our lives, health, and the way we communicate. One of the fields that technology has most influence is the medical field. It has given medical personnel new ways to improve the patient's way of life. Technology has improved the way the medical field communicates, performs surgery, and the way people care for their patients. Most people do not realize how much technology influenced their plan of care. Now, by a show of hands, how many of you go to a physician's office or the hospital? Do you know that from when you enter a hospital, your medical records are being sent to different doctors and nurses via technology? Not many people realize the technology used in their care. In the hospital, even your admission process uses technology. The difference between now and years ago is the advancement in technology in medicine. Even just 10 years ago, so many things have changed, such as the way blood is taken, cancer treatment, and surgeries. Now, how many of you actually realize the technology used in their care? Technology is used in everything throughout the medical community, taking vital signs and recording the patient's symptoms and medications. Temperature is taken using an electronic system, along with the patient's oxygen intake, blood pressure, and heart rate. Now, they even have bands that can be put on a patient's wrist to do all of these automatically. X-ray machines are now able to be portable, along with ultrasounds, EKGs, and CAT scans. All of this is to improve the simple care of the patient. Now, who here has heard of 3D printing? As Harvard writes, 3D printing is gaining increasing recognition as a technique that will transform the landscape of surgical practice. It allows for rapid conversion of anatomic images into physical objects, which are being used across a variety of surgical specialties. It has been unclear which groups are leading the way in coming up with novel ways of using the technology and what specifically the technology is being used for. 3D printing is used in surgeries of both veterinary medicine and human medicine. In veterinary medicine, it is used to help animals that lose appendages walk again. They create wheelchairs and movable slings for the dog or cat to walk. That is something that veterinarians and people never thought was possible. A dog like this is fitted, their paws are simply fitted to where they print out an actual sling for this dog to be able to fit with a wheel at the bottom. This is an example of a sling for this dog that has wheels on the bottom. 3D printing can also be used to create new flippers, beaks, or legs for wild animals, such as the beak on this eagle. 3D printing has opened doors in surgery that people never thought was going to be possible. Practicing a surgery was unheard of, and not being able to use another bone to fix a jaw was impossible. So many risky surgeries are now made somewhat easier thanks to 3D printing. With 3D printing in human medicine, surgeries such as open heart surgeries on a newborn are simply practiced using an anatomical print of the patient's actual heart. This is so that the doctors and surgeons can see any surprises that are lurking behind the actual heart. So here they take such a risky, life-threatening surgery and make it somewhat less of a risk. Here in a broken jaw, they actually 3D print a copy of the patient's mandible, and then they are using it in surgery to place the now tissue of the person back onto there. So no bone from the rib cage, no bone from the tailbone or the pelvis is used in this type of surgery. So this surgery is now less invasive and also easier for both the patient and the surgeon. Another example of technology in medicine are machines called Rita. They are portable machines that allow doctors and nurses to communicate with patients without actually physically being there. The doctor is able to see, hear, and even touch the patients with assistance from the nurse. These machines have stethoscopes, temperatures, vital sign machines, and even gloves that are able to interact with the patient so they firsthand hear this. He is able to actually interpret, being the doctor, and not interpret what somebody else is saying about their own patient. This helps faster diagnosis and even makes treatment more convenient. A doctor could be hundreds of thousands of miles away and be taking care of a patient in Barberton Hospital. It even cuts down on wait time. Portable machines can also be used as electronic babysitters to keep an eye on patients that are confused, have dementia, or Alzheimer's. Nurses are hired to sit and watch computers of the patients that have these machines in their room. This makes sure that they do not fall, rip out IVs, unplug machinery, or stop oxygen. Technology has been proven to be beneficial in the medical field. It has improved both medical personnel and patients' way of lives. I see the impact that technology has on a daily basis in the medical community. It is offering new opportunities for jobs, and it is helping to train these people to work these new machines. Technology is helping to unite the medical community, like it should be, to better the life and treatment of a patient.
Hey, did you see that new commercial for the...
One of the things that most concerns people about technology in nursing is that nurses and doctors will lose their importance of ethics. Ethics is one of the things that is extremely important to nurses and doctors. Nursing ethics are things such as honesty, integrity, responsibility, competence of care, quality of care, and the confidentiality standards of HIPAA. Some people think that because of the fact of technology, they will use their quality of care, direct nurse attention, and support. Though, what people don't know is that all the technology is used to improve the patient's quality of care, and it is done with patients in their rooms, such as charting, scanning medications, and taking vital signs. The technology used is to improve the care of the patient. All the technology is used with the patient so that they'll understand what is going on, such as vital sign machines, X-rays, EKGs, and so on. Malfunctions in surgery. Another situation that people are worried about are the excessive malfunctions in surgery. With the use of 3D printing, some people think that there is an excess of malfunctions that could happen in surgeries. A technological malfunctions of surgery and treatment through the laparoscopic machines and so on. The risk is same in any surgery done by a surgeon. Though 3D printing is used to improve and limit the risk of surgery, and has been proven to do so. 3D printing's importance is to limit the invasiveness of surgeries. And this really does help and has proven to be true. The only reason that people are 3D printing hearts and everything before surgery is to limit the risk that could take of a technological malfunction. And so, people really need to understand that the risk is the same in a normal surgery versus 3D printing. Technology also helps sterilization and limiting hospital-acquired infections. A hospital-acquired infection is an infection that you get prior to being at the hospital. So you go in with one diagnosis, and during your hospital stay, you are diagnosed with something else. Technology is allowing workers to allow more efficient ways of cleaning surgical tools and limiting the chances of these infections. One of the leading causes of death in hospitals is secondary infection. Infection control is the most important thing that nurses teach in a hospital setting. The biggest way to do this is to wash hands before and after patient contact. Technology is allowing scientists to become with more ways to be able to sterilize equipment such as steamers, and that uses the cleaning of for surgical tools. They also are coming up with new products to clean floors and beds to limit these hospital-acquired infections.